لمزيد من النقاش تنضم إلينا من القاهرة السيدة سوزان ميخائيل المديرة الإقليمية لهيئة الأمم المتحدة للمرأة. مرحبا بك معنا سيدة سوزان على شاشة القاهرة الإخبارية. بداية أود أن أستطلع منك حصادا لوضعية النساء والفتيات بعد مرور 6 أشهر من الحرب الإسرائيلية عليهن في غزة.
Well, the situation in Gaza is in many ways unprecedented. I have myself worked in humanitarian settings for almost 3 decades. And when I say unprecedented, I refer particularly to the unproportionately high death toll among civilians. Up to date, more than 32,000 Palestinians have been killed. And UN Women estimates that around 10,000 women have been killed so far. But it is when we dig a little bit deeper into these demographics that the picture becomes even more disturbing. UN Women estimates that on average, on daily basis, 37 mothers are killed, leaving an entire generation of orphans behind. But I would like to add that these are not mothers. These women are not only mothers. They're lawyers, they're doctors, they're poets, they're writers. They are the very social fabric of Gaza. And that is the situation of women today inside Gaza.
في ظل هذا الوضع المتردي، ما هي الأولويات المطلوبة؟ هناك طبعا قائمة طويلة من المساعدات والمعونات المطلوبة، لكن الأولوية من وجهة نظرك لحماية النساء والفتيات.
Well, I'll try to boil it down in 2 simple words. Immediate ceasefire. That's the first and foremost priority needed to protect civilians, women, men, boys, and girls inside Gaza. But also we need unimpeded humanitarian access. Almost the entire population in Gaza is in severe need of humanitarian assistance. There is a looming famine, and we've already registered children dying out of hunger. So we need an unimpeded access with a package of humanitarian support, including food, water, medical services, and we need it immediately.
كيف يمكن مساعدة الضحايا من ما يعرف باضطراب ما بعد الصدمة؟ ونحن نتحدث عن صدمة ليست كأي صدمة، حرب عنيفة عليهن منذ 6 أشهر، كيف يمكن مساعدتهن؟
UN Women usually provides a holistic humanitarian support package. So the humanitarian support package to Gaza right now consists of food, non-food items, blankets, winter clothes, diapers, and hygiene kits, but also a component on psychosocial support through women-led organizations that are on the ground, and those are usually the ones that have very good knowledge of the need of women and children on the ground because of their proximity. They have expressed clearly to UN Women that besides these items, a desperate need of psychosocial support is needed now, because what we're seeing is a trauma on national level. So women-led organizations and our partners on the ground are providing as much as they can psychosocial support, either face-to-face or remotely. But I want to maintain that humanitarian access is increasingly difficult. And of course, as any of our humanitarian sister agencies, whether United Nations or NGOs, UN Women is of course also challenged by the fact that there is hardly any humanitarian access guaranteed for humanitarian organizations. Women-led organizations that are on the ground are very clear with us that they are partially functioning. They can provide humanitarian assistance, but they struggle because procurement, there is hardly any items in the market. And secondly, because of access, because of course, the tremendously volatile security situations on the ground.
لو تحدثينا أكثر عن شكل أو طبيعة الدور الذي تقوم به هيئة الأمم المتحدة للمرأة الآن في ظل طبعا يعني تعرض كل مناطق القطاع تقريبا للقصف، وهل هناك منظمات أخرى تحاولون التنسيق معها؟
Of course. So UN Women's humanitarian assistance package comes from 3 countries. First, from inside Palestine and in very close collaboration with the World Food Programme. Secondly, through Jordan, through the close collaboration of Jordan Hashemite Charity Organization. And thirdly, and may I say very importantly, through Egypt. And here we collaborate very closely with the Egyptian Red Crescent. And I cannot, of course, underestimate the pivotal role that Egypt has played in this crisis in relation to humanitarian access and humanitarian assistance through Rafah.
العاملون في مجال الإغاثة وتقديم المساعدات أيضا كانوا هم من بين ضحايا الحرب الإسرائيلية على غزة على طوال مدة هذه الحرب. ربما كنا نتابع مؤخرا يعني استهداف عاملين في جمعية المطبخ العالمي المركزي. كيف تتعاملون مع هذه القضية مع الموظفين لديكم سيدة سوزان فيما يتعلق بتقديم الحماية لهم، فيما يتعلق بأيضا إقناعهم بربما بذل مزيد من الجهد في هذا القطاع؟
Well, as you correctly say, during the past 6 months, the unprecedented death toll among civilians have been unique. But equally, I would say, the death toll amongst humanitarian civil servants. There is really only one way of doing that, of ensuring humanitarian access, and that is, of course, through ensuring an immediate ceasefire. You can only provide humanitarian assistance if there is an enabling environment around you.
مفهوم يعني هو سؤال استيضاحي أكثر، يعني مفهوم أن الأطفال وكبار السن يعتبرون من الفئات المستضعفة في الحروب والنزاعات، لكن لماذا تعتبر النساء أيضا من الفئات المستضعفة في الحروب والنزاعات؟
Well, women are not only fragile elements, if I may, and this is also the reason why I initiated by digging deeper into those demographics. Again, women that have now so far been killed in Gaza, they come from all social stratas. Again, these were women that carried Gaza on their shoulders in many ways, again, as doctors, as lawyers, as artists, etc. But there are certain circumstances, of course, that puts the entire population in a fragile setting, and other issues that are distinct for women. And I want to give an example. In Khan Yunis training center, for example, 40,000 people have sought refuge. We know that up to January, only January, and of course these numbers have changed dramatically in the past weeks, 140 women gave birth. These women gave birth without clean water, many without medical assistance, those who needed anesthesia, many of those not receiving the medical services that were urgent for them. But we also hear through UN Women's partners on the ground that there is an added level of agony, not only in lack of medical assistance, clean water, etc., but very often you give birth knowing that a close family member has recently been killed. So we can only imagine the situation of women giving birth in these very specific circumstances. Then, of course, in terms of medical services in general, we know today that only 10 out of 36 hospitals are partially functioning. And we also know through UN Women's partners on the ground that a large proportion of women with chronic diseases, such as cancer, are at the moment receiving no medical treatment. This medical treatment is critical for their very survival.
هل تقديم المساعدات والإغاثات للضحايا خلال شهر رمضان يشكل صعوبة أكبر أو تحدياً أكبر من بقية الأشهر، أم أنه الصعوبة واحدة نظراً لتردي الوضع بشكل كامل في القطاع؟
I would say that it's very difficult to say categorically that it has been more difficult or less difficult during the holy month of Ramadan. From our experience, it has been difficult throughout, from day one. But in general, I would say that in the past couple of weeks, we have had certain levels of intensified difficulties, particularly related to entry into Gaza. And I think also we have seen very explicitly in the past 2 days the difficulties in providing services while you are within Gaza. And we saw that, and I'm referring particularly to the situation of the number of humanitarian colleagues killed only 2 days ago.
شكرا جزيلا سيدة سوزان ميخائيل المديرة الإقليمية لهيئة الأمم المتحدة للمرأة، كنت معنا من القاهرة.